Hey guys, this is Dr. Brian Wolfe with Wolfe Physical Therapy. Here I'm making a video for CrossFit athletes on wrist pain, specifically when you do cleans, or if you're doing clean and jerks, when you catch the bar in this position, in the clean position, the hang clean position, and get pain with wrist extension. It can be really painful. I've had it myself. Catching a bar like this, or I've seen a lot of athletes that have it too. And two quick techniques. One is a taping technique that's really good. The other one is some repetitive motions that can be helpful. So I have some pre-strapped out tape. Before I strap myself up, I'm going to show you the technique, so that you don't have to, so I don't have to fight myself to the tape. So we're going to get on the floor, and you can see on the floor. Now, a lot of times loaded extensions, this is extension, this is flexion, will be painful because that was the insulted injury when you catch the bar. So you usually can move into different directions, 3 directions. So if I'm moving this way, this direction, or this way, and you want your palm to be completely flat on the ground. Now, if this is painful, which a lot of times it can be because you caught it that direction, then you actually want to try this direction into flexion. Now, I can tell you, I feel a stretch right here, so as I move down this way, I want to be very gentle as I move into this flex position. But I'm moving in different angles, mainly because when we catch that bar, the central nervous system, if you catch it in a funny position, will hurt, because you would, if you caught it into this extension, a lot of times it's because of shoulder mobility, so don't catch it on our shoulders. But it's a nice, gentle, painless movement. So as we're doing this, what we're trying to do is just guide our wrists in different directions into this flex position. So you're trying to play with the different angles and just reteach your body that this is no longer painful and take away the pain threat and the pain perception. So this is a nice way to desensitize the wrist. You can also, if this hurts and this is the insulting direction, you actually want to go in the other direction. You want to go this way. Now, one of my favorite tips that I ever heard, and that I've used with all of my patients I felt is great, is adding some traction. So we have 8 bones right here that go in 2 rows, and we want to pull this away. So what we're doing is, and I'll do it on my right wrist so you can see. What you're going to do is you're going to hold your hand on the other hand like this, and you're going to pull away. So my arm from my shoulder is pulling up this direction. So as I pull up, I'm now going to lean a little bit. I'm not putting a lot of weight on my arm. I'm putting it mostly on my fingertips here. But as I pull away, I'm going to come up and over like that. And then in different directions, just like that, in a pain-free way. Each time fighting for a little bit more range of motion. And you can also do it this direction, holding down, and you pull up through the arm and pull up towards yourself. Each time going in different directions. And you may find that certain directions are a little more painful than others. Move out of the way a little bit so it's a little bit easier to see. So you might find that moving in these different directions one might be a little bit more painful. But what you don't want to do is you don't want to overdo it. You want to gently do it. Take it to the pain, then back it off. Take it to the pain, then back it off. What you should see over time is actually that pain decreases as you do it. I tell people the pain intensity would be like if you brought your finger back and you felt the pain, then you relaxed, the pain went away. Put your finger back, the pain came on, the pain went away. That's the intensity that you're doing. Okay, so this is how some of the directions you can try for some of those quick tips. If you have any questions, you can always visit our website at wolfphysicaltherapy.com or give us a call, because this can be a little tricky to treat or to learn in 5 minutes. But if you notice, I'm putting my fingertips away from me, and then in this way I'm putting my fingertips towards me. It just helps you get a little bit more leverage and a little more comfortable on the wrist. Now let's go over the taping technique. I'm sorry for my dirty desk here. But what we're going to do is we're going to work on that same concept of flexion and extension. So here's extension and flexion with a little bit of traction. I have some pre-stripped tape, but you can use athletic tape. And if we think about how the wrist moves in the flex position, extended position, also ulnar and radially deviates, but we're not really addressing that in this particular technique. But what you're looking for is the midpoint of the wrist, and the first tape is going to go almost right along the wrist, if you can see that, okay? And it's going to come up, and you're going to start with the middle, and then you're going to come up just like this, on a bit of an angle. So it's not perfectly rounded. In fact, mine can even be a little bit higher, but if you notice what's happening here is I'm not bringing the tape straight across because I don't want to create a tourniquet. So what you want to do is you want to bring it straight across here, and then it veers up a little bit. The next piece of tape goes halfway up the first one. So just like this. And this could have even gone a little higher up on my wrist, actually. So if you're having more pain, up a little higher, this could have stood to be a little bit taller on my wrist. Okay, just like this. Okay. And the idea is where I would have probably put this a touch higher, what now would have happened is when I bring it back like this, I'm actually getting a distraction here. And then we're also going to go on the other direction. So here, you're going to put it halfway. And this one I am going to put a little higher. Like this. It's all about comfort. However you feel more comfortable, you can play around with this. Use athletic tape. I'm using Leuco tape here. It's a little more expensive. It's tape that PTs use. It's what I had lying around. I was actually looking for athletic tape, couldn't find it. So I just used Leuco tape instead. And again, you're going to pull it up. And you're going to pull it up. Okay. So now it's straight across on the back. And veer it up on the top here. And I pre-measured this tape so that you didn't see me like messing with it all over the place on the video and trying to tear it. But essentially what I did was you can use the back of the tape if you're trying to measure. It is easier to do on somebody else. That's why this one came a little low. But what you can do is you pre-test. I have the tape at the back of it and pre-test how long you need it before you rip it. So I already had known how long this was going to be before I ripped it. And then you can rip it so you're not wasting tape. So then again, halfway along the top. Good, try also not to let it stick on itself. That also makes it tricky. And it doesn't need to be perfect. Like I said, this one's a little higher now, so I might have put this a little lower. But the more you practice it, the better. It's easy. It's an easy technique, and I love this technique because it's a desensitization technique. It blocks a lot of the motion, so when you go to do certain things like in CrossFit, so I'm going to pull this back up again. So when you go to do certain moves in CrossFit like hang cleans, it's actually going to be giving you a little bit of a therapeutic distraction. So here, when I go into my wrist extension, what I'm doing is, if you can see it, when I'm doing this, it's actually giving me a traction movement here. And then why I do both sides, the first, you can do it for one side and then not the other. But what I love about it is now if I go in this position, I'm actually getting a mobilization with movement. So I'm separating. If I have two rows, I'm actually creating a touch of separation between the two sets of bones, these two rows of the anatomy. And it makes it feel more comfortable. Along with the fact that it blocks a good 5 or 10 degrees of wrist extension. I mean, it doesn't limit me too much, but it's probably limiting me about 5-10 degrees. So if I do a CrossFit move and I do the hang cleans and I get it caught, I'm not going to hit that like really painful end range movement. And so you can usually wear this for like 3 to 4 days using ice, decrease inflammation, and just by decreasing inflammation, that a lot of times can cause an improvement in pain. So something you guys can try. Great self-treatment technique that I use myself if my pain ever gets up. Actually, this feels really secure now. It doesn't hurt at all. So I love this technique and I wanted to share it. So if you ever have any questions, you can always call us at 203-998-6522, or you can visit our website at wolfphysicaltherapy.com and shoot us an email or anything like that if you ever have any questions. Thanks. Take care.